Hello, I am Harshdeep Verma from Karnal. I have been balding since the age of 16, and after my confidence level was very low, I decided to get a hair transplant from Chandigarh, and there were 2 sessions during which they first covered the front part of the head and then the crown part of the head. But since my hair loss was very extensive, the result of the hair transplant was not up to the mark I was hoping for, and I still had to keep my hair short because even though I grew them out, the volume of the hair was not that much that it looked natural. Then I started researching if there were any alternate options to boost my experiment I had conducted on the hair transplant. So after researching, I found out that there is a process called scalp micropigmentation, and one of the best clinics that conduct in India was the Saraswat hospital. So I immediately set up my meeting at the hospital, and I received a video conference consultation from Dr. Preeti, and she recommended 3 seedings for me. I have already received my second seeding and I'm feeling very confident. Because I traveled from Karnal, I had to stay over for 2 days, and the level of hospitality provided here was excellent. Moreover, the behavior of the staff and the level of customer service offered was amazing. I was so happy with my result that I also wanted to get a laser hair removal from the clinic themselves, and I am very happy that I came here. Thank you.
You just listened to what Harshdeep had to say about his hair loss treatment and then SMP he had done with us. Here I want to tell you something. Age of Harshdeep when he went first hair transplant was 22, and the second hair transplant was done when he was only 23. So in such lower age group, below 25, if somebody is doing 2 hair transplants for you, for front and for crown as well, it means long-term treatment planning for you was improper. Why? Because age is very important, very significant on what treatment you should be undertaking for your hair loss. So number 1 treatment for anyone undergoing hair loss is medical treatment. Once you see the effect of medical treatment, you see the effect of various PRP therapies or mesotherapies, then you do a conservative transplant for somebody who is in his early 20s. But nowadays, with mushrooming of so many FUE clinics every nook and corner of your city, we are seeing more and more such cases of over harvesting of FUE areas, thick FUT scars. On top of it, very less growth on the recipient side, bad hairlines. In nutshell, bad hair transplant is seen more and more nowadays because of any reason whatsoever, which makes all of us clinicians sad. Saying all this, I want to tell you that for people like Harshdeep, there is a ray of light for you. There is scalp micropigmentation, which can give you a buzz cut look, a shaven look, even if you underwent 2 hair transplants, or I have seen 3 hair transplants, and still you are not in a position to keep your hair long, to have a good frontal hairline, to give a good look and style to your hair. You can always opt for buzz cut, and how it is done we'll discuss in a very short while. My name is Dr. Preeti Saraswat, and subscribe to this channel for such educational, informative testimonials and videos. So you see, in Harshdeep's case, the number of grafts taken from the back already exceeded his donor capacity, and they did not grow in the front and mid scalp or even crown so that he can sport a good hairstyle. So further hair transplant is not possible taking donor area of scalp. So maybe in future he goes for body hair transplant or things like that, but now since he already underwent 2 hair transplants and he is not even 25 years of age, he is not in a position to take any more surgeries. So he opted for scalp micropigmentation. We offered scalp micropigmentation for him. How it is done? It's a medical tattooing of ink on your scalp such that it gives an illusion of hair coming out, budding out of the scalp. So it will not give volume to your scalp. But if you shave your hair, then after SMP is done, it looks as if you have shaven the whole of your head, and the density of hair on your head looks normal because the dots, they look like hair follicles coming out. In order to admire the regained confidence of Harshdeep, do click the like button. Here I want to emphasize some facts about SMP in a shaven look, in a buzz cut look, as we did for Harshdeep. First of all, we have to do proper marking so that we know how much anterior we have to come. then the sideburns, then the back area also, along with the crown. So we know exactly how the flow of dots has to be there, so that a natural looking density we can produce on the scalp without transplanting, so by the SMP dots. If you go for SMP at a center, you must understand that the ink the center is using should be organic. It should not fade away in a greenish or brownish hue, so that the naturalness of SMP is gone. Then the machine they are using is a proper SMP machine, giving beautiful small tattoos of hair follicle like, and not the body tattoo, which is a very crude form of SMP. And then the most important part is everything should be sterile. It's in the way that it should be disinfected. There should not be any complication to SMP, and for that the therapist, the doctor, the center, they all should know their work, and they should be able to show you some testimonials of patients also, which they have done previously. If you want to know more about how we did the planning for him or for any patient like him, you can ask in the comment section below, or you can call us on the number below, so that we can have a consultation with you. We are happy for the confidence Harshdeep has gained after his 2 sessions of SMP. Looking forward to his best appearance after the 3rd session, which we'll be doing for him in the coming month. Do share this video with your family and friends who have a lot of scalp visibility even after hair transplant. To know about reasons why hair transplants fail, click the video on the left, and to know more about scalp micropigmentation, click the video on the right.